Republicans have put this country on a crash course that will endanger American lives and will threaten the financial security of millions upon millions of families. For years, Republicans railed against the Affordable Care Act and pledged that they would repeal and replace it with something better. They had 7 years to come up with what their alternative would be. 7 years. But only after weeks of backroom dealing, where 13 Republican men, not even a Republican woman senator, was in the room to talk about the consequences to women's health care, a big part of what we did under the Affordable Care Act, under the essential benefits. The only people who are better off under their bill are millionaires and health insurance company executives. That's because the Republican plan gives the wealthiest Americans, the Warren Buffetts and the Donald Trumps of our society, a huge tax cut they do not need, paid for by taking health care away from those who need it the most. And you don't have to take my word for it. You can see it right here in their draft bill. As you can see, I've been going through it, making tags, so that when somebody challenges me about what I'm about to say, I say, well, don't believe me, here's a section. So look forward to that opportunity. Page by page, this Republican plan forces Americans to pay more for less comprehensive health care coverage. And while we're still waiting for the final numbers, they just put this out yesterday, but you know, they want to push this through next week. No debate. When we did the Affordable Care Act, which some people call Obamacare, we actually had 56 different committee hearings and markups. I sit on the Senate Finance Committee. That was one of the two key committees that had jurisdiction. We sat for days and days and then weeks of markups. And then the Senate Health Committee did the same thing. And then we went to the floor of the United States Senate, and for weeks we debated what the law would be. So whether you agree or disagree, it was fully transparent. There were literally months and months and months of where there was public exposure, debate, and input. As a matter of fact, over 120 Republican amendments were included in the law. So we had a process, but not behind closed doors. You know, I've been around a while in public service with my good friend Councilman Quintana, and when you're doing something good, you want everybody to know it. You want to be out there telling everybody, hallelujah, look what I got for you. But guess what? When you're doing something bad, you want to be hiding it. And that's exactly what we have here. And while we're still waiting for the final numbers, every indication suggests that the plan unveiled by Senate Republicans yesterday will be even more devastating to New Jersey than the mean-spirited, unpopular bill passed by the House of Representatives earlier this year. If President Trump thought the health care bill in the House was mean, I can tell you that the Senate Republican plan is downright nasty. It still increases deductibles, and it slams families with higher out-of-pocket costs. It still defunds Planned Parenthood and undermines the Affordable Care Act's hard-won protections for women. It still imposes a crushing age tax on middle-aged Americans, and if you're middle-aged and middle class, you're likely going to get no help with insurance at all under their plan. It still rolls back key consumer safeguards, like the guaranteed, and that word is incredibly important. You know the difference between something you may have and something that's guaranteed. When something's guaranteed, you're going to get it. When it's may, you may not get it. It rolls back the guaranteed protection from lifetime limits. What does that mean? It means if we have insurance and we have, God forbid, we have a serious illness like cancer. And now, in the old days, you had a limit on your insurance policy, and when you hit that limit, but you were still sick, no more money from the insurance company. Everything above that limit was out of pocket. And to the extent that you worked hard your whole life, maybe you had a home, you're going to lose it. You're one illness away from bankruptcy. We took that away. That reality, that was no longer the case under the Affordable Care Act. But this Republican bill does not guarantee to have that protection from lifetime limits and the coverage for pre-existing conditions. Now, I've been hearing different things on the news. There's a very clear, I want to tell my friends in the press, go to page 135 of the discussion draft. And basically, where it says waivers for state innovation, section 206, that basically ends the guarantee of coverage for pre-existing conditions. So it's not what some are saying. It also ends the Affordable Care Act's federal guarantee that every health plan, whether you got covered at work, whether you got covered on the exchange on the Affordable Care Act, whether you get covered through Medicaid, that every health plan cover essential health services like prescription drugs, prenatal care, hospital stays, visits with specialists, treatment for substance abuse, and more. I had included a provision here for those families who have children with autism. That's part of the law. That guarantee is not there. And of course, this cruel and misguided legislation still eviscerates Medicaid. Let me be clear about something. With this bill, Senate Republicans do far more than end the Medicaid expansion where so many working families got their health care. Because under the Affordable Care Act, we expanded Medicaid. This bill does more than end that expansion, which would leave over 500,000 low-income New Jerseyans with no options. The bill ends Medicaid as we know it. It fulfills a decades-old right-wing mission to shred the social safety net. And it abandons vulnerable children and pregnant women, families living paycheck to paycheck, and seniors with long-term care needs like MS and Alzheimer's disease, and nursing home stays. Apparently, Republicans in Washington have forgotten that President Trump won the Republican nomination after being the only candidate on a crowded stage who said he wouldn't cut Medicaid. He wouldn't cut Medicaid or leave people dying in the streets. And yet, that's what this legislation does. In New Jersey, our hospitals and doctors and health centers will likely lose over $30 billion in Medicaid funding as restrictive caps on states take effect. Caps that will not, as my Republican friends like to say, give states more choice over how to run Medicaid. But when you take all that money away, it gives states no choice but to leave nursing home patients out in the cold, cut off services for Americans with disabilities, and deny low-income children a fair shot at the American dream.
Wow, that's a shame.
We can't let this happen. We have to spend every moment we have in the coming days working to stop Republicans from passing what is clearly a cruel bill. And one of our best hopes for doing so, perhaps the only way, elections have consequences. And I'm not saying this in a partisan way. There is a Republican president, there is a Republican majority House of Representatives, there is a Republican majority United States Senate. Elections have consequences.
That's right.
But the people still have power. And that power is manifested if they speak up. Because when people speak up at home, some people see the light in Washington. So we need more and more Americans to speak out as they know about this bill and say, no way. And to call their representatives and their United States senators in order to ensure that this is not something they'll vote for.